Welcome to MS Research Australia's Research Report. I'm Dr. Hamish Campbell, and in this series we explore the research that's going on in Australia and around the world. In this episode, we talk to Dr. Ai-Lan Nguyen. Dr. Nguyen is a neurologist who's also completing her PhD in MS. One of the topics of her doctorate is the effects of pregnancy on MS, and this is what she had to say.
My project is looking at pregnancy and multiple sclerosis and trying to better understand the role of pregnancy in MS. And what I'll be doing is looking at women and all their pregnancies before the onset of MS to see whether or not possibly having pregnancies before MS may be protective and delay the onset of MS. So the role of pregnancy in MS has undergone huge change, I think, in the last 20 years. So up until the late 1990s, women were actually advised not to have children or not to fall pregnant because it was thought to be a bad thing for multiple sclerosis. And then fortunately there was a large seminal study in the late 1990s that showed that actually during pregnancy itself, patients' relapses go down. So that potentially pregnancy was protective against relapses. So since then, we're now trying to explore pregnancy over the course of a woman's lifetime. So not just immediately the role of relapses when they're pregnant, but also looking at whether pregnancy has a role in terms of being protective for the onset of MS, and another role of obviously whether having children or having pregnancies during the course of MS may reduce disability in the future. And my project is looking at pregnancy before the onset of MS. Currently, at the moment, we don't know whether having children before MS is a good thing or whether it doesn't change anything. So we're asking all women who attend the MS clinic to fill out the surveys. The great thing is that we have a lot of their clinical information, such as when they developed MS and also when their first symptom was. And we have that on a system called Ai-Lan, which is linked in with a larger registry called the MS-based registry, which is one of the largest MS registries in the world. And we can use that information to see when the diagnosis was. So we can compare women who were pregnant before MS to those who weren't pregnant before MS to look at the time frame from when they developed MS to see whether or not women with pregnancies may have had potentially a longer onset or would have been diagnosed at a later stage compared to those who didn't. So what we'll be looking at is whether or not women who did fall pregnant before they developed MS may actually have had a longer period of time to developing MS because of the pregnancy itself. So ultimately we're seeing whether pregnancy before MS delays the onset of MS. And the extra part of that is that maybe the more children someone has, maybe the more protective it is as well. Looking at the historical studies, we did see that protection in each of the trimesters in pregnancy, but particularly in the third trimester. But we also see about possibly a quarter of patients actually had an increased risk of relapses in the 3 months, especially after delivery. But overall, in the 1 year postpartum, the risk of having a relapse is probably quite similar to the year before they become pregnant. So despite that increased risk of relapses in the 3 months postpartum, it does level out again. We are now seeing with some newer studies that actually there are women who are relapsing during pregnancy, but we do believe that with better treatments available at the moment, women are becoming pregnant when potentially in the past we may have told them not to become pregnant. So we do have very active MS patients becoming pregnant, and often these patients may have treatment during the course of their pregnancy, and that's why we may see in some studies that there are more relapses during pregnancy for certain groups of patients that have highly active disease. So there is that emerging group, I think, of patients. The good thing about that is that we do have great treatments to help protect these women as much as possible compared to, say, 20 years ago. We may not have had that option. But it also does present a challenge for neurologists. I think we're looking at both the time to when they develop MS and also the time to something we call clinically isolated syndrome, or CIS, and that's the onset of the first symptom. So with patients who we may see with CIS before they develop MS, if they do wish to become pregnant, at least we will have extra information to counsel them on that decision. Because the more information we have, the more empowered patients may be to make that decision if they wish to obviously start a family at this point in time. Because as I mentioned, there was that fear in the past of starting a family, of becoming pregnant. And I think that if we're able to reassure patients that there isn't any harm, at least, to having pregnancies, it would give them that extra reassurance. So that would be hopefully the one of the benefits of having the research.
Now that's a brief snapshot of Dr. Nguyen's research into MS and pregnancy. Of course, everybody's MS is different, so if you have any questions about your MS and pregnancy, make sure you talk to your neurologist. As always, like us on Facebook and subscribe to our YouTube channel for future research reports. I'm Dr. Hamish Campbell, and I'll see you next time.